This is our webinar for vSim for Nursing, a remote simulation solution for independent learning. This will be an hour long, and with that being said, we're going to start now. My name is Lizanne Fratsky. I'm the Product Marketing Manager for Nursing, and I will be monitoring the Q&A in doing an introduction and trying to field your questions. Jeannie Staton, she's our Strategic Account and Implementation Specialist. She will do the majority of the presentation, and that is it for the presenters. To some of the housekeeping items. We have everyone muted just to make sure there's not a lot of background noise. If you could, please turn off your video. That will help us minimize any technical issues. We are asking you to use the chat function. So there's at the bottom a Q&A function that you can insert your questions, and at appropriate times throughout the webinar, we will answer those directly, and then at the end there's a time for Q&A. If there are any other questions that are not answered throughout that time, we will send out an FAQ, and you can always contact your account manager if there's something pressing that you need an answer to. If you need to leave early, please make sure to reach out to your account manager. If you don't know who that is, you can also call 1-877-LAIRDAL. You can ask for a free trial license, and you can also receive information about pricing, as well as any questions that you have, you can raise there. Shortly, I will post a few links in the chat window. There's an NCSBN study that we would like to share, as well as a vSim brochure. And to kick us off, we're going to hear from our president, Neil Weber.
Great, thanks, Lizanne, and thank you everyone for spending some of your precious free minutes with us during what has to be an unbelievably stressful time for you and your coworkers in this global coronavirus crisis. I know our team has some valuable information to share with you, so I will be extremely brief, but just want to reassure you about 3 points on behalf of Laerdal's North American organization. Number one, we are here to support you, our customers, our business partners, and in many cases, our friends and family, however we can, okay? Number two, as always, as it pertains to our online solution, vSim, we will assist you every step of the way from discovery to implementation, as they say, and any special circumstances that may apply to your institution. But from an overall operational standpoint, I just want to reassure everyone and confirm that Laerdal is functioning as an organization more or less to our normal standards during these very abnormal times. So there may be some small delays in getting equipment and people to a particular location, but we are showing up either on site or via remote access at the customer's discretion. And lastly, I just want to emphasize that we are open to any and all requests for help that you need, as well as any suggestions you have for additional things we can do to help others get through this crisis. Just contact us through whatever channels work for you. Reach out to your local representative or any Laerdal employee, and that includes me. Use our website, contact customer service via phone, email, or chat, or social media. And lastly, God bless everyone. I'll hand it over to Jeannie. Thank you.
Thank you, Neil. Welcome, everybody. My name is Jeannie Staton. I do welcome everybody in this unfortunate circumstance, but I would like to share with you a little bit about vSim, my role here at the company. I work on the sales development team, but I do specialize in our digital suite of products. So we are here to discuss vSim for nursing. So today we are going to cover the need for a virtual solution to assist in the current situation. We will provide an overview of the program vSim for nursing. We will also discuss the individual units that comprise the full simulation window. We will review the instructor tools provided within the program that does document the simulation time, as well as provide competency scores for your users. We will also discuss the process for the vSim code distribution, as well as the next steps in the adoption process. And we will also share the resources available for a successful implementation. As Lizanne did state earlier, I will go through this presentation, but we will pause at intermittently to ask for any questions or comments. And again, if you want to go ahead and type those into the chat box so that they are ready to be answered when we do pause for those breaks. The remote learning due to COVID-19. So understanding that you have to move very quickly your instructional materials to an online learning platform. We will discuss how to do so. We will talk about the resources that are required, because even though we are moving instructional materials online, we want to make sure that they are measurable as well as repeatable. And then we'll talk about how vSim does support that flipped classroom approach and active learning. So overall, I won't read this slide to you, but many people are familiar with vSim for Nursing. Initially in its development, we partnered with both Wolters Kluwer and the National League for Nursing to develop a program that would allow students to practice nursing care in the virtual environment. Many of you are very familiar with our patient simulators. So understanding that physiological response that you see when you care for that patient in the sim lab, that's the same technology that we're using in the virtual environment. So if you administer a wrong medication to the patient and he has an adverse reaction, it's the same type of response that you can expect in vSim, but again, it's in the virtual setting. Along with Wolters Kluwer, who provided the content for the remediation resources as well as the preparation material. And then we had the NLN, who validated the steps that are required to achieve certain competency scores in the program. And then we take our technology, and together we were able to develop vSim for Nursing. This is an overview of the modules that are included in the program. So following the core nursing program of your program, so we've got different subject areas. There is med-surg, mental health, health assessment, maternity, pediatric, gerontology, fundamentals, and pharmacology. We also offer a combo module of maternity and pediatric. So what you're looking at here, each subject or module includes 10 scenarios. I want to repeat that. So there's 10 scenarios per module. The modules do follow the nursing core curriculum. So each of these individuals include 10 scenarios. So as we look at this library of offering, we then can see that each of these modules include the 10 scenarios. What we're looking at here in fundamentals, these are the patient cases that are featured in vSim, and it also provides the disease state of the patients. So again, this is the med-surg. We've got 10 scenarios. There are 5 core and 5 complex. And again, this is the same format for all of the subject areas. They do follow, again, 5 core, 5 complex. If you are familiar with the NLN scenarios, these are the same patients. So you may be very familiar, your students may be very familiar with Carl Shapiro and Jennifer Hoffman. Those are the same cases, along with the ACEs cases for our gerontology. So all of them do follow the same model, 5 core, 5 complex. We also offer a combo module of 5 maternity and 5 pediatric cases. So now I'm going to go in. This is probably the #1 question that I have received is, how do we use vSim for Nursing for making up missed clinical time? So in this time, we have to make sure that our students get enough contact hours in clinical in order to graduate, right? So vSim for Nursing, in this suggested workflow, what we're following is that we provide the students with the suggested reading, and then they go through this workflow, steps 2, 3, 4, 5, and 6, and all of this together, along with the reading material starting in step 1, what we are saying is that beginning here at step 1, going through the workflow and ending in step 6 is a 2-hour window. Making up for missed clinical time, Lisanne had shared earlier that she will post the article, the study from the NCSBN that stated that up to 50% of clinical time can be used with simulation. So there are also different guidelines in that study, and we want to make sure that we're not stating that just simulation in itself, but there are practices that are suggested in that study that need to be adhered to in order to qualify simulation for missed clinical time. That is all outlined in the study that she posted. But in terms of that simulation, what they did state is the simulation has to be good simulation. It has to be quality simulation. When we developed the program, we worked again with the NLN and we followed those guidelines, making sure that we did adhere to what made good quality simulation. So again, we are posting that. So if you need any reference material on what it is that makes simulation, quality simulation, and it does follow those national guidelines, we're going to post that into the chat box. And if we need to send it, we can do the same. So I want to make sure we review those contact hours again. We're saying from step 1 to step 6 is a 2-hour window because it does include the suggested reading as well as the steps 2 through 6. So once again, we're taking the 2-hour window going from the suggested reading to the end of step 6. So that's 2 hours per scenario. In each module, there are 10 scenarios. So 10 scenarios times 2 hours is 20 hours in each module. And then we have 8 different modules, right? Those are the different subjects in the nursing core curriculum. So we have a total of 160 contact hours included in the vSim library. So I am going to pause. I know there are several questions, Lisanne. If I can pause right now and make sure that we cover and everyone understands that calculation.
Yes, we have quite a few questions, and I'm trying to group them as best I can. So I guess the most pressing one for some is there any focus of vSim for respiratory therapy, non-invasive or invasive ventilation?
That's a great question, and it has been requested, but the development of vSim initially, we did develop for the undergraduate nurse. So the content that is included in the scenarios really does follow the nursing curriculum. So at this time, no, I don't think it would be as in-depth as needed for a respiratory therapy program.
Okay, then we have a couple of questions for different programs. So the question is, do we offer emergency medicine module, anything for ADN students, or let's see, BSN versus emergency medicine, APNs? So I don't know if you can speak to that a little bit, the audience for this.
Absolutely. So again, when vSim was developed, it was geared for the undergraduate nurse. Beginning with an LPN program, because of the scope is different, right, for LPN versus a registered nurse, the fundamentals, the mental health, and the gerontology all have applicable content that would fit very nicely in an LPN program. For ADN and BSN, all of the other modules are ideal. The med-surg module that again includes 5 core and 5 complex. There are 2 ED cases as well, and then their complex cases will include some critical care as well, but there's not a separate ED nor a critical care module. But again, the med-surg cases does include some of that content. As for the graduate level, again, this was developed for the undergraduate nurse. However, I would highly recommend if your program is really needing some content and you think that it could be applicable, please just request a trial and we can give you access to the program so you can navigate through on your own to see what points and what concepts or topics are covered that may align to your curriculum.
And we can put together a list because I'm seeing all of the questions come in about what about LPNs, what about practical nursing students. So an action item for us is to put together a list of maybe some recommended modules or scenarios for some of these, and then we can send that out as a follow-up piece to our attendees.
Absolutely. Okay, I think that's a great idea.
And there are some questions about Canada. So if you can maybe speak to that for a moment, then I think that will clear up some of the questions about Canadian content.
Absolutely. So the vSim in itself is offered in English. So there's not a French version at this time. Some of the content, however, because it does link out to a live database that is used in hospitals, there are references to Canadian formulas or Canadian measurements. So there is some type of different measures that do refer, but in itself, it's not specific to Canada. But I will say I have seen a lot of Canadian schools come on board in the past year outside of the situation that we're in right now. So there are some modifications that can be made perhaps on your side to help launch, but it is being used today in several Canadian schools.
Okay. And I think there was one more question that I think we should address now is the 2 hours, the 2 contact hours, does that account for students doing the simulation more than one time?
Oh, that is an excellent question. Thank you so much for the person who asked that. The window of introduction of the scenario. So the first time the student is introduced, that is that simulation window of 2 hours. However, the student does have unlimited attempts within the scenario. So if that student completes multiple attempts, that's additional time that is added to that simulation window. The simulation itself in that window is a 30-minute max. So the student has 30 minutes to care for the patient in the virtual setting. It may not take him 30 minutes, but that's the window that's provided, and the program will automatically shut off if he hasn't completed care within that window. But since he does have unlimited attempts, he can go in and care for that patient, score a certain competency score, and immediately go back and try again and again. And what we're seeing is, in its intended use, is if you require a specific competency score or benchmark, the students again can go in unlimited times until they reach that benchmark. So it may take someone 6 times, it may take another student 12 times. And those hours are going to be different, again, depending on that student's pace of learning, but those will be documented as additional time spent in that simulation window. Great question.
So I think at this point, you may want to move forward. I will still keep track of the questions.
Sure.
Some questions that were asked will be addressed as we move forward and look at the actual software. So I don't want to hold up right now.
Perfect. Thank you very much. So again, we're looking at if you have the full library of vSim, 8 different modules, that's 160 total hours available, again, in the entire library. What we're looking at here is the class management roster. This is how you would track that time and those scores. What you see on the left is my roster of students. This column here is the indication whether they have completed the pre-sim quiz. So step 2 in that workflow was the pre-sim quiz. Since vSim was really designed to be a self-contained learning module for students, that what we want are for students to be able to read in that step 1. Then they go forward to step 2, which is this pre-sim quiz. It is a static set of questions. Students would just answer them. Whether they complete the questions correctly, we suggest the student should move on to the next step in the workflow. If he cannot answer the questions, we suggest moving back to step 1 and do more reading. So you, as the administrator, would simply see a check mark whether this pre-sim has been completed. What you see here under score, this is the highest achieved score in the scenario. So before, when I was telling you, some students may take 8 attempts, some others may take 12, and that of course is going to be different per student, but this is the highest achieved score made by each student. And again, flipping the classroom, we want the students to take onus of their own learning. We, as the administrator, you can just take this macro view and you could see if your students are on pace. So if your benchmark, again, is 90%, and you take a quick glance at your roster and you see that most of my students have not achieved that benchmark score. So at this time, is it time for me to intervene? That's up to you. If you have other faculty who are also sharing this view with you, maybe they want to take some of the students to see, okay, I see a couple of zeros here. They may be challenged, and maybe I can reach out to them to see if there's any issues. Is it a technical issue? What is it? Is it time management? What can we do to help? But again, this is just a macro level to see if your students are on pace. Within every scenario, the students are then marked whether they are doing the correct step following the path of treatment, or if they make an error, you do get an indication whether an error was made. Those errors are then graded per se by an X. So the number of X's indicate the severity of the error. So again, quick glance looking, this student scored a 55%. He made one single X error, 2 double X, and 2 triple X's, hence that 55. So these severe errors, these could be something that may cause severe damage to the patient. The single X errors could be something he did correctly, but perhaps he did it out of sequence. So again, this is just a quick glance. And then this 20% here, this is the post-sim quiz. All students then have, after the scenario, the next step is to take a post-sim quiz, which does assess their understanding of the scenario content. And this is the score. You are able to see the achievement score of the post-sim quiz. And once we get into the software, I will show you what that quiz looks like. So now I'm going to go ahead and move into the scenario or into the software here. And this is what vSim looks like. So when the students do access vSim, they will go to the library. They will have several different accesses depending on what subject or what modules you adopt. But as you can see here, here's vSim for maternity and pediatric, vSim for med-surg. So I'm going to click here on the vSim for nursing, and this takes me to my instructor portal. This is what your access would look like. You do get to see the student view here. And then of course you have your instructor resources listed here on the right. One of the best features I have heard in terms for faculty is the program itself is very intuitive for students. However, launching the program or introducing it to your students, instead of taking time to really explain what it's about, we do have this vSim tutorial. And again, in spirit of the virtual learning, you could simply take a link of this web page, post it into your LMS, whether using Canvas, D2L, Moodle, Blackboard, and simply ask the students to review the tutorial before they go into the program. So this does provide an overview. It explains the tabs and how to navigate through the program for a successful competency score. There is also a user guide for students, so they can always access this. It's instructions step-by-step of how to utilize the program. In the same breath, for faculty, here, this is a getting started video. It provides training and onboarding for your faculty as well. If you have clinical instructors or if you have any adjunct faculty that you want to also access vSim, you could just, again, direct them here. And this is modules that will help them, again, be introduced to the program. It provides an overview and step-by-step on how to really launch it with your students. The other portion here that's very helpful in terms of instructor resources are the scenario overviews. So when I click here, if you are planning your semester now or the rest of the semester in the situation that we're in, and you need to see where the content aligns with what you're teaching, these overviews provide pretty much a script of the scenario. So if I wanted to click here on Jennifer Hoffman, and I know that asthma is the next concept that I will be teaching, I can use these overviews to align, again, with my lesson plans. Here's my learning objectives. And then it goes into more detail. Here's my patient details of Jennifer. These are the provider's orders that are included in the scenario. It even provides the nursing diagnosis. And then again, it goes more into detail and even provides the overview of the path of treatment that will be required in the scenario for your students. So this is a great planning tool. If you're moving forward, you need to know I will be talking about hip fractures. I want to see which scenarios will align to specific concepts. This is available through your instructor resource portal. Okay, next, I'm going to move into my classes, and this is this green link here in the right upper hand corner. This is the mini LMS that's offered through the program. I have changed the names to my courses reflected here under class name. If you have different cohorts or sections of Med-Surg, for example, you may have an NUR 112 and you have an A, B, and C section. You can create specific names for each class so that you can keep those cohorts of students separated. In the same breath, if you wanted to keep your clinical groups separated, you can also name them by section. So here I have 11 different clinical groups. I may have named them by different sections, here indicated. You get to provide that naming schema for your groups. And you also will be able to add different instructors to have that same access per each of these groups. So again, if you've got your clinical instructors or any adjuncts and you want them solely to have access to clinical group 1, you can do so. And I'm going to walk you through that in just a moment. But here I am I'm going to go ahead and look at clinical group 10, and I click view. This is my roster of students. And here I can access individual vSim results. So I want to look at student 4. I see that he has completed 2 scenarios. Here are his highest achieved scores in each of those scenarios. And now I want to see what it is. I see here that he scored a 95, so I'm confident that he comprehends this content. But at this 65, I want to see what's going on. So when I click, this takes me to the feedback log of this specific student's attempt in the scenario. What is the feedback log? These are the steps, these are the clinical decision-making steps made in the scenario. So now I have insight in what this student chose for the nurse to do in the scenario. He introduced himself, he washed his hands. So I see these green check marks and I see that he is on that correct path of treatment. When I see an X here, this indicates to me that an error was made in the scenario. So here I see that the oxygen rate was 0. He applied oxygen, but he didn't turn the rate up to 6, which was the suggested level. So again, I can see what decisions were made. I can see what errors. And then down here at the end, I see a timestamp. This is the amount of time that was spent in the scenario. So somebody had asked earlier, how do we add more time to those attempts in the virtual simulation? Here I see that there was 9 minutes and 54 seconds spent by this student in this scenario. This was only one attempt. The student can provide for me a screenshot of this, of the timestamp, as well as the date of completion. And I want him to do that because although we want to really trust our students, but sometimes they do try to take shortcuts, right? And we don't want this to be a collaborative assignment. So this is just one extra step of prevention. If we have the students timestamp the date of completion as well as the time, as well as how much time was spent in the scenario, again, it's just that one extra layer of security that the students are having to do their own work. I want the students to submit this to me, and all of these prints of their feedback log now create a documented registry of the time that this student has spent in the virtual simulation. So I want to pause here, Lisa, if I can, and ask for any questions on the class roster or the timestamp taken from the feedback log.
So there have been a couple of questions specifically to some of the back-end stuff. For example, do other instructors have the same access as the facilitator?
Excellent question. When I'm in my clinical group, so again, we're looking at clinical group 10. As the administrator, I'm the person who set up this class. So I get to determine here under co-instructor link, I can then send the link to a co-instructor, and once he or she accepts my invitation here, he or she will be listed as a co-instructor here under active co-instructors. So once you send this email to an instructor, he or she will then be a co-instructor to this specific clinical group. So this, again, this works well if you have any adjuncts, any clinical faculty, or if you have different locations and you may want different faculty to have access to specific cohorts. This is great just to see if you're on the same track. It does standardize instruction, right? So if you know that some instructors are assigning these scenarios, and then you can take a quick glance just to see the progress of their students to see if you're on the same track. Great question. Anything else about the feedback log or the roster?
So there were a couple of questions that I thought we might want to address here is the system requirements. Does this platform work on iPads, iPhones, MacBooks, Chromebooks, PCs, etc.?
Excellent question. vSim for Nursing is web-based. So every time the student, as long as he or she has internet access, as well as faculty, they can access vSim from any PC or desktop. It does work on a tablet, but because it is flash-based, it is not accessible on an iPhone or an iPad. Everything else, all of those other operating systems, you can access vSim. However, we strongly suggest that it is a desktop, laptop, or PC, and that's solely because some of the assessments, for example, require a lot of specific detail. So we want the students to have that resolution to be able to provide adequate care in specific situations. So again, it does work on mobile devices as long as it's not an iPhone or an iPad, but we strongly suggest that it's on a computer or laptop because of the requirements of the learning program.
There are also some questions about vSim and Flash and some of the technology. And yes, there is some upgrade coming in the summer, I believe. So that addresses Flash specifically. Another question came in regards to quizzes and repeating the simulations. So can they also take the quiz multiple times, and do they have the opportunity to repeat and improve their score before submitting to instructors?
Yes, great question. So the students do have, when we're looking at an individual's results or the class results, let me go ahead and just pull up Jennifer Hoffman. So I gave the assignment for all students to complete Jennifer Hoffman. I wanted them to achieve at least a 95%. So here's my macro view. This is the highest achieved score so far. Every time they go in and attempt the scenario, if they achieve higher, that's what's going to be listed here. This 30%, again, is their highest score. If they answer the post-sim questions again and score a 50, the next time I log in and it syncs, I'll see a 50 here. So this also changes to their highest achieved score.
I think that's it. I think we're good so far.
All right, great. So now I'm going to go ahead and jump into the actual program. So I am clicking on vSim for Nursing, and I'm scrolling down here. Here are my 10 scenarios. Again, 5 medical, 5 surgical, and I'm going to click on the Jennifer Hoffman scenario. So what I'm looking at here, this is my workflow. Once again, here's my suggested reading, pre-sim quiz, the actual virtual scenario, post-sim quiz, documentation assignments, and guided reflection questions. This is the background of the patient. Right here, what you're looking at, these are the pages in the Wolters Kluwer. Remember the partnership that I mentioned earlier? The Wolters Kluwer textbook is appended to each scenario. If you're using the Bruner text, these are the pages in that textbook that do support the content of this one specific scenario. If you are not using a Wolters Kluwer or Lippincott textbook, that's okay. But if you are, we also have a course solution that includes the embedded textbook along with the virtual simulation, as well as adaptive quizzing. And that product collectively is called CoursePoint Plus. So that is why this link is, or this link could be here, is if you were using CoursePoint Plus. But again, if you're not using this textbook, it is okay. I would just ask the students to disregard these pages. However, this down here, these are the appended links for this one specific scenario. So I am looking at Jennifer Hoffman. She is an asthma case. And what I need to know as a user is included here. So when I click on this link, it takes me to Lippincott Advisor. This is an actual database is subscribed by hospitals today. And this provides content for nurses in terms of caring for patients. This is giving me all of the nursing content on arterial blood gas analysis. So it does give me the description. It gives me the teaching points. What are the steps in diagnosis? What are my labs? What are my abnormal labs going to look like? So when we say that we want the student to go through the suggested reading material, this is all of the content that we're providing for the students. Again, supporting that active learning, flipped classroom approach. We are providing the students a one-stop shop, easy to access. So the students have all their learning materials that they can prepare to care for the patient in the virtual setting. So this is Lippincott Advisor, and Lippincott Procedures and Skills is updated regularly. If it is drug content, which I will click here on albuterol, this is the full drug monograph of albuterol. So this is the Canadian references that we mentioned earlier. So there are available forms and dosages, and it does give the translation. So I can see my indications and my dosages. I see the Canadian references. I see the spelling as well as the pronunciation. I see the black box warnings. I see the indications, the contraindications, everything I need to know about this drug. The great piece about this is updated every 10 days. So we are truly providing evidence-based content for your students to prepare to care for those patients in that virtual setting. If there was anything that was announced by the FDA in terms of albuterol, this would update. So again, every 10 days, the drug content is updated. Procedures and skills are updated every quarter. So I want to pause again, Lisanne, and ask if there's any questions regarding the textbook references, the pages, or any of the appended suggested reading.
Yes, there were a couple of questions about incorporating their own textbooks or resources.
Okay, perfect. Because this is web-based and it is a pre-programmed scenario, as well as all of the content that's provided here, this cannot be changed. But what I would suggest is, depending on which learning management system you use, you may want to include the reading pages in your portion of course content in Moodle or D2L, and then give them the assignment. This is for the Jennifer Hoffman case. So the students can read the textbook content before they even enter the website, all depending on the pages that you provide if you are using a different textbook.
Great. And are the drugs from the Lippincott also pediatric sensitive?
If we're in the pediatric cases, then it will be. So it all depends on what the scenario is. There's a lot more drug content, for example, in the pharmacology cases. So it all just depends on the specific scenario. But the pediatric ones will be pediatric focused in the pediatric scenarios. Good question.
And then someone asked if you can tell if the student actually uses the resources.
That's also a very good question. No, I would say that you would be able to tell by their competency score if they're unable to achieve those high scores. You know that they haven't read the material because of all of the steps required in the virtual simulation. You have to choose the correct path. You have to do it in the right sequence. There has to be enough time in between those selections. And it has to be, the sequence of steps all put together in this algorithm that generates that score. So it would be very difficult to haphazardly go through the scenario and achieve a high score. There's really no way that there's not going to be a lot of preparation in order to achieve higher scores within the scenario.
And along the same lines, is there any way to, does the scenario change each attempt? Or, how can you combat cheating or, people taking notes and learning the correct sequence?
There's really, again, there's no way, just like with any online material, when students are doing the work remotely, there's not 100% foolproof way that we can prevent them from sharing their answers or working. But again, if you have them print screen, since it does screen print the time as well as the minute it takes and the seconds, as long as you're making them do that, it does put that extra layer of prevention in there. Because the scenario adapts to each selection, everybody is going to get a different path, all depending on what they select. So it does adapt to each individual's choices. So it would be difficult to ever get to 100% completely similar or mirroring each other's work.
Okay, and maybe two last questions before we move on is there a specific competency score that we recommend or that is a benchmark?
Great question. It does follow the traditional scale, 10, 20, 30, 40, etc. However, that competency score, that's up to you. The way I look at it, the 70 is kind of very similar to a bell curve, is that thick part of the bell, right, is roughly around a 70. As you get into the higher numbers, the 80 and the 90, those are going to be those high achievers. And as well as if we're going to be using this for missed clinical time, we want to ensure that these students truly do understand the material. So I would recommend a very high score. Again, they're not going to be able to achieve that on just 2 attempts. They will have to go and they will have to learn what they did and what they didn't do and go back and retry to continue to improve that score. So if you are using for that situation, I would recommend a 90, 95 at least.
And lastly, are there any recommendations to help students with disability? Is there closed captioning?
There is not for the actual virtual scenarios. We can provide the WACG, I believe is what addresses the ADA requirements, and I can provide that for you, but in the scenarios itself, there's no closed captioning.
Okay, the last question, is there a maximum number of tries the student can complete the scenario, or does it keep going?
No, that's a great question. It's actually unlimited attempts. I do want to say though, going back to the closed captioning, it's not closed caption, but everything that's communicated in the scenario is visually shown. So there's comment bubbles or communication bubbles when there's any type of communication. So when we get into the program, I think you'll be able to see that better.
Okay, I think we are all set.
Okay, so this is a pre-sim quiz, static set of questions. Again, 8 to 12 questions. If you get them right, we suggest to move on to step 3. If not, we say go back to step 1. In the actual scenario, again, 30-minute window, students will have the capability to complete care. After 30 minutes, the program automatically shuts off. Over here, when I click here to see results, this is my history. So here are where students are able to get to every single attempt that he or she has completed in the scenario. So as you can see here, I've made lots of attempts. And as I select any of these, it gives me that feedback log that we viewed earlier that shows each step and every decision made in the actual scenario. So now I'm going to go see this patient. And here is my record. This is me as the nurse. I'm standing outside of the hospital room and I'm about to go see the patient. I do want to check the patient's chart. Here's the medication administration record. I want to see what orders are available for the patient. I see ECG, here are my medications. And as soon as I click this X, this is where my time starts, and this is where vSim is now recording everything that I'm doing in the scenario.
Hi, I'm Amy. I'll be your primary nurse today. I'll wash my hands first. Please state your name and date of birth.
My name is Jennifer Hoffman. I was born on January 31st, 1987.
Everything matches. Are you allergic to anything?
Hay fever.
She is breathing at 30 breaths per minute. There is a lot of audible wheezing in the chest. There is increased respiratory effort. This is a pulse oximeter which monitors the oxygen level in your blood. It fits snugly around your finger but should not hurt.
Okay.
I'm going to pause it right here. This is usually where the chat box lights up and the nurses are screaming at me to give the patient oxygen. But what I want to explain is all of these tabs allow me to freely select what to do next in the scenario. So the user or the student can select to attach a pulse oximeter. And if you noticed here, once I did that, her O2 stats are registering here in the patient monitor. As I continue, I can apply blood.
I'm attaching this blood pressure cuff so we can monitor your blood pressure continuously.
Okay.
So again, here's her blood pressure registering below. I paused the scenario. I might be taking a study break. I have to answer the phone. Someone came to the door. Once I pause on the scenario, it does not count against that 30-minute window. So again, students are at home completing the scenario. If there's some type of interruption, if they have to pause, they're able to do so, and it does not count against that 30-minute window. Over here on my right, each of these does expand into additional options for me to choose or select. And as I go through here, there's nothing scripted that I have to follow. So vSim is not going to make me go through a specific sequence. It's going to allow me to openly choose what to do next. So here I'm going to pause. I'm going to give her some oxygen. I didn't ask her anything about her history and communication.
Do you have any pain?
No, I don't have any pain.
Does anything make the pain better?
I'm not in any pain.
Does anything make the pain worse?
I'm not in any pain.
So as I continue this line of questioning about pain, it is going to ding me on the back end, right, of the competency score, because I continue to ask about pain when she doesn't have any pain. But if I were to go on again, the correct path of treatment, if I have to go with any interventions, if I need to administer any medication, I can do so.
Let me just assess your IV.
I can select the wrong drug. It's going to allow me to do that. I can administer a medication as soon as I walk in the room, but of course that's not what I want to do or what should be done, but it is going to allow the student to make the mistakes here in the scenario and learn from those mistakes or errors and go back and try to improve his or her score. So the realism of the scenario is we've got our audio, we've got the beeping of the monitor, and so it is an immersive experience for the students. And as the students, again, they complete the steps of the scenario, it's recording what I'm selecting. And then when I'm done caring for this patient, I would go here to patient handoff, and this is what ends the scenario. So I know right now that I have not provided adequate care, but if I select end scenario, it's going to give me a very low score of 17%. But now as a student, I can read, this is what I did, and I see several places where there's room or opportunities for improvement. Well, I'm not really sure what albuterol is. So if I click here, it gives me my remediation resources in the moment, and I can now learn what is albuterol and how does it apply to this scenario. So again, it's this self-enclosed learning module where the students, again, they have all their resources at hand. So let me go ahead and continue. I'm going to go out of the scenario, and then I'm going to go back into my workflow. So once I've completed the scenario, I can take a post-sim quiz. This, again, is a static set of questions. It asks me my questions here. The one difference between post-sim and pre-sim, it's going to give me my answers immediately at pre-sim. Post-sim, I have to go through the whole quiz in order to get a score. And vSim, again, the self-paced modules for student learning, independent learning, as soon as I complete the quiz, it is going to give me my score and my remediation resources all in one place. So I really am haphazardly answering these questions. So I answered 2 correct. Here's my question. Here's what I answered. This is the correct response. And it also provides the rationale for that question, as well as, again, links to the resources for remediation on this specific question. Okay, so we're going to continue the workflow. I've taken the post-sim quiz. These are suggested documentation assignments. If you do not have an EHR that your students are using, someone shared in the last session, they just downloaded the questions, they modified and said, complete a care plan for Jennifer Hoffman. And so they, used this and they just sent the assignment through their own LMS. So you can use the suggested assignments and not necessarily have an EHR. We do link to what we have as an academic EHR, which is DocuCare. So the patients here in vSim are preloaded into DocuCare. So it is a seamless transition for students to be able to document what went on in the scenario. But again, this is not necessary. You can download these suggested assignments and use them as your own. And then we also have the guided reflection questions. This is downloadable. You can download, it takes you to a Word format. You can modify the questions, and then again, you can upload those into your own learning management system, or you could use this as a class activity. You give them the assignment, you want the students to achieve a certain competency score, and once you come back and meet virtually, you can pull these questions out and then have a class discussion. Or you could have it as part of the workflow and have each student complete these questions and answer them, and then submit them, of course, as part of their workflow. So that takes us back to what different resources are available. As we did go through under your instructor portal, there are instructor materials that will help you. There's the implementation guide, as well as the user guide, and a student tutorial to help launch the program. This number here is the tech support line that was created solely to support the digital suite of resources. I very much, first thing is I urge students, do not contact your faculty or instructors. If you have any type of technical issues, please contact this number. It is available till 12 midnight Eastern, and they can walk you through any type of technical issues, whether it comes from password, if you can't remember your password, or if there's any type of delay in the program. Again, any type of technical pieces, we ask them to call that number. Now, we are offering a special short-term license bundle for those that are going through. Again, we're here for unforeseen circumstances and we want to be able to help you. So we have created a special bundle for pricing. The standard access for vSim is 12 months per each subject module. So again, the fundamentals, for example, those 10 scenarios, unlimited access for 12 months. The one exception is MedSurg, that is a 24-month access. Other than that, if you're in a situation where you are needing just a short-term access for your students, please reach out to your Laerdal account manager. They can walk you through the pricing offering, as well as the standard or the special. To expedite the process, if you are looking to move forward with vSim, and if you want to move forward and you need those codes quickly, we ask that you have the number of license needed in your program, as well as which subjects. So again, if you need 200 students and you need MedSurg and fundamentals, if you'll know the exact number of students and the number of faculty licenses that you need, if you'll have that at hand, that will expedite the process for us. We also have a market order form, and if you could have that signed, and we can walk you through that process, or your account managers can do so. If you have questions about it, you can always reach out to them. The typical turnaround time that we are seeing currently is 48 hours. So as soon as we can get that order, what we have been seeing is a typical 48-hour turnaround. Because of the influx of requests that we have been getting, that may fluctuate just a little bit, but that really is the expectation that you should see if moving forward. So Lisa, and I want to turn it out now for any questions. I want to be mindful of your time. So for those who cannot stay, I want to thank you so much for joining us. If you do have questions, you are more than welcome to reach out to your account managers or to myself. But otherwise, if you want to stay on, type in your questions. Lisanne, if you want to go ahead and let me know what some of the questions are.
Yes, so maybe something to clarify, there are 8 modules and then 1 additional combination, a pediatric maternity module. Those can be purchased separately. So this is not a full suit that has to be purchased. You can purchase just pediatrics if that's what you need. So there's no need to buy the entire suite of modules. That's just what is available. And there's several questions about pricing. Please do reach out to your account manager. We're currently offering a short-term license because of the situation that many schools are in. Yes, those are 3 months, and then the standard are 12 or 24 months. I will again post the vSim for nursing brochure. In there, it lists all of the scenarios that are within each module. But you can also visit our webpage and or look at the website that you signed up for the webinar for, and that has that information on there as well. Several are asking how fast can you get access. That's why we're saying please reach out to your account manager that they can quote you. It is a per license, per student license. So it's not an institutional license, it's per student. So you will need to know how many students you have and how many modalities you would like. And then they can run through that process fairly quickly. There are instructor licenses that are free of charge, so you can go in and explore, as well as free trial licenses for you to go in and see the student side to make sure you are familiar with the scenarios. Yeah, so the number of faculty, the number of licenses that you would need per module, that's what you would need to reach out to your account manager. That would just speed up the process. And then there were a couple of questions, if people are still on. There was a question about responsiveness of the patients during the simulation. So yes, as they are treating the patient, they get better or worse, so it is responsive. There was a question specific to community health modules, as well as EMS modules or ADNs, LPNs, you know, all of them. So please reach out to your account manager. There may be other options beside the vSim for Nursing solution. There is a UMedic curriculum that may be an option for some, so we can provide that information as well. So please make sure to reach out to your account manager. And I'm trying to see what else.
If I can reiterate on that, Lisanne, so if you're looking for undergraduate nursing, vSim does apply and fit well into that curriculum, as well as the LPN. However, if it's a graduate level nursing, we do have UMedic that is great for bedside cardiovascular assessment. Ask your account manager about that, and that is a fully self-paced course for online learning as well. And as for the EMS, there is not anything specific for EMS. I had a call right before this, and we discussed if your students have not completed certification for BLS or ACLS, then that is also an online option as well. But again, your account manager will know this information, so please feel free to reach out to them for that.
I will, again, the webinar itself is recorded. We will share that at the probably tomorrow morning. And we are putting together, there are a lot of more questions that have come in that are fairly specific. So we will try to answer all of those and send out some form of FAQ document to make sure everyone has what they need. So if we don't, if we've missed your questions and you need the answer, right now, please reach out to your account manager, and they will either answer directly or field those questions to us.
Okay. Well, again, thank you for joining us here today. We do want to make sure that we get your questions answered. So whether you can reach out to your account manager or either put those in the chat box, we will make sure they get covered. If you do not know who your account manager is, if you will please list your name and the school that you are representing, we will make sure that your account manager reaches out to you. And then otherwise, thank you so much. I hope you have a great afternoon and stay safe. Thank you.
All right, we will conclude this webinar at this time. Thank you.